You used to hit the gym, stay active, feel strong. But somewhere after 50, something shifted. Maybe you noticed you're not recovering like you used to. Your energy isn't the same. Your motivation to even work out, gone some days. And if you're honest with yourself, things in the bedroom have changed too. You haven't told anyone. Maybe you've just accepted it as part of getting older. But here's what nobody told you. This isn't just aging. Your body is sending you a very specific signal. And there is one exercise that medical research shows can actually reverse it. Not slow it down, reverse it. And most men over 50 are either doing the wrong thing entirely or nothing at all. Stay with me, because what I'm about to show you changes everything. Here's what's happening inside your body. After the age of 30, testosterone begins declining at roughly 1 to 2% per year. By the time you're 50, you could have 20 to 30% less testosterone than you had in your prime. And by 60, some men are running on half. Now, testosterone isn't just about sex drive. It controls your energy, your mood, your muscle, your mental focus, and yes, your sexual health. So when it drops, everything drops with it. Here's the frustrating part. Most men do one of two things. They either give up and accept it, or they start doing more cardio, longer runs, more cycling, thinking they're being healthy. But cardio alone does very little for testosterone. In fact, excessive endurance exercise can actually lower it. What the research points to is something completely different. And it's not a pill, not a supplement, not a hormone injection. It's a specific type of exercise, and the evidence behind it is stronger than most men realize. Let's talk about what the research actually says, because this matters. Multiple studies have looked at how different types of exercise affect testosterone in older men. A meta-analysis published in Frontiers in Physiology reviewed dozens of studies specifically on older men and exercise. The finding? Aerobic training, running, cycling, swimming, produced small increases at best. But resistance training using large muscle groups? That's where the hormonal response was strongest. Here's the mechanism in simple terms. When you put heavy mechanical stress on large muscles, your legs, your back, your chest, your body interprets this as a survival demand. It responds by releasing testosterone and growth hormone to repair and rebuild. The bigger the muscles involved, the stronger that hormonal signal. Research from Northwestern Medicine confirms this. Compound exercises that work multiple muscle groups simultaneously tend to have the most significant effect on testosterone levels. Studies using squats, for example, have shown free testosterone rising by 40 to 55% above baseline immediately after a session. Now, I want to be honest with you here, because this is where most channels exaggerate. That spike is temporary. Testosterone returns to baseline within about an hour. But, and this is the key, when you do this consistently over weeks and months, the cumulative effect on your hormonal baseline is meaningful. Combined with improved body composition, reduced body fat, and better sleep, resistance training is the most evidence-supported natural intervention for testosterone in men over 50. So what is the exercise? It's not one single move. It's a category, compound resistance training. Specifically, exercises that load the largest muscle groups in your body, your legs, glutes, and back, simultaneously. The top 4 for men over 50 are, number 1, the squat. Whether that's a bodyweight squat, a goblet squat holding a dumbbell, or a barbell squat, this is the king. It works your quads, hamstrings, glutes, and core in one movement. The hormonal response is well documented. Number 2, the deadlift. One of the most complete exercises in existence. It engages your entire posterior chain, hamstrings, glutes, lower back, upper back, traps. For men over 50, a Romanian deadlift with dumbbells is often safer on the lower back than a barbell from the floor. Number 3, the bench press or dumbbell press, upper body compound movement, chest, shoulders, triceps. Pairs well with lower body work. Number 4, bent over row or seated cable row, pulls the upper back and biceps, balances the pressing movements and supports posture, which matters more as we age. Here's a simple starting protocol for men over 50. 3 days per week, not 5, not 7, 3, with rest days in between. 3 sets of 8 to 12 repetitions per exercise. Moderate weight, challenging but controlled. Focus on form first, depth and control over heavy load. Now, before you grab a barbell, there are important things you need to know. First, if you have cardiovascular disease, recent surgery, joint replacements, or uncontrolled blood pressure, please speak to your doctor before starting resistance training. This isn't a disclaimer I'm reading to protect myself. It genuinely matters for your safety. Second, form overweight every time. A heavy squat done wrong can damage your knees or lower back. A light squat done well builds hormonal response, muscle, and protects your joints. Start lighter than you think you need to. Third, and this is important, overtraining works against you. Research is clear that excessive exercise without adequate rest actually lowers testosterone. Your body needs recovery time to produce hormones. More is not better. 3 quality sessions per week beats 7 mediocre ones. Fourth, realistic expectations. You will not feel different after 1 session, or even 1 week. Give it 8 to 12 weeks of consistent effort before judging results. Hormonal change is slow and cumulative, but it is real. If after consistent training, you still feel low energy, low libido, and poor recovery, talk to your doctor about getting your testosterone levels tested. Exercise is powerful, but it's not a replacement for medical evaluation when levels are clinically low. Here's the part most videos skip entirely. Exercise is the trigger, but 3 other factors determine whether your body can actually respond to that trigger. Number 1, sleep. Testosterone is produced primarily during deep sleep. Studies show that men sleeping less than 5 hours a night have testosterone levels comparable to men 10 to 15 years older. If your sleep is poor, your exercise gains will be blunted. Period. We'll do a full video on sleep and testosterone soon. Number 2, body fat, specifically abdominal fat. Fat tissue contains an enzyme called aromatase that converts testosterone into estrogen. The more excess fat around your middle, the more testosterone you're losing through conversion. Resistance training helps here too. Muscle is metabolically active tissue that helps reduce fat over time. Number 3, protein intake. After 50, your muscles are less efficient at using protein. Research suggests men over 50 need more protein than younger men to maintain and build muscle, around 1.2 to 1.6 grams per kilogram of body weight per day. Without adequate protein, the training signal fires, but the rebuild doesn't happen. So, the formula is compound resistance training, plus quality sleep, plus adequate protein, plus reducing excess body fat. Each one amplifies the others. If this video gave you something useful, something real, then I want to ask you one thing. Drop a comment below and tell me, what does your current exercise routine look like? Do you do any resistance training? I read every single comment and I'll reply. And if you want to go deeper, the next video covers the 7 silent signs your testosterone is too low after 50. Signs most men have been ignoring for years. That video is right here. Subscribe if you haven't yet. This channel is built on one promise: no exaggeration, no miracle claims, just real information that actually helps men over 50 feel like themselves again. I'll see you in the next one.